Hey guys, welcome back to the 34th episode of the Dr. Battisi show. Today we meet the man
Hello.
behind many smile makeovers, Dr. K and Trivikram Rao. We can refer to him as Dr. Vikram. We will be discussing the hidden mystery behind smile makeovers because we are not exactly taught what is from A to Z in the dental colleges, and we will be talking from a clinician point of view and in a language which everybody can understand no matter how they are connected to dentistry. He is often described by his patients as a dental artist. He has crafted over 6,500 smiles over 19 years. He completed his graduation in 2000 from Bangalore University and followed it with a fellowship from United Kingdom. Then he completed post-graduation in Cosmetic Dentistry, Aesthetic Dentistry from Manipal College of Dental Sciences. He was awarded the Best Cosmetic Dentist by Times Health Achievers from Times of India. He has also pursued the prestigious fellowship from ICOI, which is International Congress of Oral Implantology, in November 2006. So guys, ICOI is the apex body in the field of dental implants and cosmetic dentistry, headquartered in the U.S.A. And he has his own practice in Bangalore. And sir, it's our pleasure to have you here. A very warm welcome.
Thanks a lot. It's my pleasure to be here.
Thank you, sir. Sir, so I would start from the very beginning. Like, what exactly is smile makeover? And is it different from cosmetic or aesthetic dentistry, or is it a part of it, or what exactly it is?
No, it's actually not different from cosmetic dentistry or aesthetic dentistry. It is more of a what I would call it as a patient educating term. So cosmetic
Right,
dentistry or aesthetic dentistry is for us to learn. It's a science. Okay, science
right,
coupled with art. Whereas you really can't explain what is cosmetic dentistry or aesthetic dentistry to a layman. So you would call it a smile makeover. Basically, anything that relates to appearance, change in appearance in terms of the smile and teeth becomes cosmetic dentistry, aesthetic dentistry. In turn, it becomes smile makeover for the patient. Okay.
right.
So it is a part of aesthetic dentistry or cosmetic dentistry. Whenever you are touching a front tooth, which will actually change the appearance of the patient, it becomes a smile makeover. It could be one single tooth, or it could be one full arch. It could be just a filling in the front tooth, or a missing tooth, or even orthodontics. So any of these becomes smile makeover.
Right. And so, like, what exactly goes into it? If we talk about what treatment options are available when we say aesthetic or cosmetic dentistry, so one is veneers. Now we want to know what we can do with a smile makeover.
See, Veneers is the far end of the spectrum where smile makeover covers. That is the highest
Exactly.
that we can do in terms of aesthetic dentistry. But the basic thing that you can do, even a good composite filling for a class
Right.
3 or a class 4, or a small diastema closure, or changing the size of a tooth, like in case of a peg lateral, or sometimes even a good prophylaxis with a good polishing, or even teeth whitening. All of this become part of smile makeover. So it could be as simple as a good cleaning and polishing of the teeth and teeth whitening, or it could be at the highest end, which with porcelain veneers, including gum recontouring with laser, or even CLP. So all of this basically becomes smile makeover in any case.
Okay. Right. And
And
so,
it could
like,
also, sorry.
yeah,
It could also cover various, parts of dentistry. Like it could be orthodontics, it could be periodontics,
exactly.
it could be prosto, and sometimes even endo also comes under this. So, see, basically, if you understand, there is no post-graduation in cosmetic dentistry in India, right?
Yeah.
So, if you take every department and put it in terms of aesthetic sense into a front teeth, as far as you are dealing with the front teeth, it becomes a smile makeover or cosmetic dentistry. So, it encompasses
Right.
everything, every field of dentistry that we have known, that we have learned in BDS.
Exactly. So because every branch at the end dentistry, we should be looking good. Next is we should
Yes.
be having no problem while chewing, speaking, swallowing, etc. So it completely comes under the category of dentistry or aesthetic dentistry for that matter.
Yes.
So like if a patient comes to us, patient wants a smile makeover. They know this term. But from our point of view, when the patient requires a smile makeover and we see their teeth, how to know that, okay, yes, this is the case we need to select for the smile makeover? How to select that case? What things to consider for?
See, with the proliferation of internet and the social media, most of the patients, especially in urban, I mean, forget urban. Actually, I see that even in small towns and rural areas, they
Right.
already come with asking for it. They come asking for it. They come asking for, I need porcelain veneers, I need a smile makeover, I need this to be changed. So most of them come with their own questions, their own research, of course out of Google knowledge. So they come with that. So at least if you're already known for that work, your job becomes easy. That okay,
Exactly.
so that person is known for smile makeovers, that person is a cosmetic dentist, so they come looking for that. But for someone who is known for general dentistry, or who's just coming out now and then started a practice, what I would suggest is, if you think that the patient requires a smile makeover, you can just inform the patient and leave it at it. Pushing the
Right.
patient. So, for example, a patient comes to you with pain in a molar, and you also see that he has got huge gaps on the front teeth and severe gummy smile and discoloration. So the first job, I know you as a dentist, especially someone who is new into practice, you would get excited. Oh, this is a good cosmetic case. This is a good smile maker case. I really want to do it, and then I really want to impress the patient with my results.
Yeah.
Okay, and I want to excel in this. But if you forget the main problem for which the patient has come and then keep pushing the cosmetic dentistry, it's not going to work for the patient.
Exactly.
You could always introduce the concept of that to the patient, not necessarily on the first visit. First visit, you take care of the main problem of the patient. Take care of
The
pain
chief
part of
complaint,
it.
right?
Yeah. So then make sure that he's happy with what you've already done, and you've done a good job, and he's impressed that okay, you have done a good job, and he's happy with it. Then you can always introduce the concept of a smile makeover or cosmetic dentistry and tell, okay, I see this as a problem in your front teeth. If you feel that okay, this needs to be fixed and you want that to be done, I can give you solutions.
Exactly.
I think the best part is to leave it at it. Then most of the times what happens, they go back, they do their own research and try and understand what happens. Then they come back and ask you, okay, can you do this, and I may want this. Then you take the patient forward to what they really want. Because
Right.
you know how to do a cosmetic job, pushing that job to that particular patient who is not interested is not going to help you. Even I don't do it. My
Right.
mainstay is cosmetic dentistry and smile makeovers. But when the patient comes to me for a different problem, I fix the problem first, then think of it, or give the option of cosmetic dentistry to the patient. So
Right.
that's what I would definitely advise.
Exactly. Thank you, sir. And for example, sir, how a BDS can start their journey of smile makeovers? Because even if we do a composite, personally, sir, I just love composites. If given a choice, I will only do composites for my whole life. Because
Okay.
it's like it's in your control. It's not like any other material that sets in within 30 minutes or 10 minutes. It's in your control. So I like to build and modify that. So for a BDS, how can we start our own smile makeover journey?
See, what I would say is, if you have come out just now out of college, you've completed your 4 years and then internship, and then come out and then started a practice on your own, I would suggest at least for a year, do only general dentistry.
Right,
Just get the feel of it. Just get the feel of it.
Exactly.
Do good crown preparations, do root canals, extractions, whatever can give you the experience of handling the patient's mouth.
Exactly.
Develop the soft skills. Sit and talk to the patient. Explain the newer techniques, the technologies that are available. So
Right.
you get the hang of it. First, you should know that you are comfortable doing certain things in the patient's mouth. Then what happens, as you start doing more and more general dentistry, then you will realize that you are good at a few things, you are not so good at a few things.
Yes.
If you feel that okay, you are good at, see, everybody wants to be cosmetic dentist or a smile maker, just like everybody wants to be a surgeon. Many of the doctors who come
Right.
out, but it will take at least, I would say, like some 300 to 500 patients and at least about 365 days to analyze what you are good at and whether you really enjoy doing that particular specialty, then you can move on to that field. Like you like doing cosmetic work like composites, yes, you start initially with basic things. After a year, I'm talking about you are doing patients for a year, and you start with basic class 1s, class 2, so you know how to handle the material, you know how to handle the instruments, and you build from there. If you don't learn basic class 1 cavity preparation in your third year, would you be able to become a good cosmetic dentist in doing front teeth?
Never, sir. Not a possibility.
Yes, and the exposure that you get in college is very less for you to become a specialist post graduation, right?
Right.
So if you have your own practice, my sincere suggestion, get some patients for free and do lots of cases.
Right.
Like how we would do in final BDS or third BDS, go out, get those patients, and then probably pay them also and make them sit and do it. So after a year of good practice, then you realize that okay, you understood the properties of composite, or you understood porcelain, basic crowns, you understood PFM. Then you start with composites first, because composites give you that, like you said, you enjoy doing composites. It's a very good thing, because it really gives you that hands-on feeling.
Exactly.
So when you start molding the material, when you start actually putting it on the tooth, and then start sculpting and finishing, polishing, you really enjoy doing that. So then you understand that you are cut out to become a good cosmetic dentist.
Right. Okay.
Then start doing basic cases, then slowly move up the ladder. So the learning curve is very important to get to where you want to be.
Exactly. So definitely these will be the initial steps that, if taken care of, we can build a really good foundation for our profession. Sir, so what is the latest technology available in smile makeovers?
See, the most advanced and latest at this point is DSD, Digital Smile Design.
Okay, right.
Have you heard of Dr. Christian Kochman?
Yeah, I have.
He's the founder of DSD. So you could actually follow him on Instagram. He's very good, and he also has some tutors in India who teach DSD.
Okay.
But again, that is for someone at least who has done like a year of work, then learn more. It would help definitely.
Right.
That is the most advanced, and of course CAD cams have come in big time now. Digital impressions, all of that have coming big time also in India. So that also is a very good thing.
Okay. So if talk about instrument, I came to know about this instrument like 2 years back. It was Ivoclar Optrasculpt.
Yes.
And when I just saw, I have not practiced with it, but when I just even saw the videos or how it is done, I just felt it made life so simpler. So initially, if we are opening a setup, should we have that? If we have inclination towards cosmetic dentistry, because it's little expensive, I guess.
It is expensive, but it's really worth it. I have been using it I have forgotten for how many years I've been using, probably more than 7 to 8 years. From the time it was available in India, I have bought it.
Right.
It's an excellent equipment.
Exactly.
It's an excellent instrument. You really the major problem when you're actually adding composite on a tooth is, if you're doing with any other instrument, you end up with either porosity or the surface is not uniform. You end up creating craters.
Right.
This is a non-sticky instrument with a flat surface. Now you really can sculpt it well.
Exactly.
So that makes the job really, really good. So I would highly recommend that instrument.
Yes, sir. Any other your favorite equipment or material from your own like this composite thing that you would recommend?
If you are into composites, there is an instrument called Zacria from Dentsply.
Okay.
So since you deal with composites, I guess when you are actually, imagine this is your gum line, you have done a composite here. Okay.
Right.
You have polished the entire surface, but you always find it, under the gum margin. It's so much difficult to actually polish that area, because if you try to use a burr, you would end up cutting the
you would end up cutting the gum.
Yeah, and if you don't polish that, patient comes back with a brownish line after a few months,
Right.
because that is not polished.
Yeah.
So Zagria takes care of that problem. You can adapt it to the gum line and actually push it up. So your gum is very nicely pulled up from the margin CJ. Then you can actually see your finish line of the composite. Then you can use a fine burr or a carbide, ideally carbide, to polish that part. That's my
Right.
favorite instrument when it comes
Okay.
to smile makeovers, especially with composites.
Right. So when we do a composite filling, sometimes we feel, there is discoloration. We have like got the patients who feel that this has discolored within the short span of time. One can be we have not polished it. One reason. The
Yes.
second could be the patient is consuming a lot of colored food, maybe. And
Yes.
smoking as well. Any other reason from our point of view which we can correct for the like it might not discolor so easily?
See, the initial polishing has to be excellent when you're when you're finishing the composite veneer. And second, always when you're curing the final layer of composite,
Right.
use KY jelly.
Okay.
That prevents an oxide inhibiting layer.
Okay.
Okay,
Right.
so you have imagine you are you're working on a fluorosis tooth, right?
Right.
So you have prepped the tooth and then added layers and layers. You still have the final layer. So you have your Optrasculpt. So you
Right.
have applied the final layer. Now you know that this is the finish. Don't
Right.
cure it. Don't cure it yet. Apply jelly, KY jelly, then cure it.
Okay.
So
Right.
now what happens? The porosities that are there on the final layer is taken care with the KY jelly. So it prevents the
Right.
oxide inhibiting layer. Then once you cure it, it is set. Then you can
Exactly.
finish and polish it. So that prevents an immediate discoloration that can happen due to technical failure. Technical failure is our mistake.
Right. Right.
Okay. So discoloration can happen due to patients' habits or mistakes, or because we haven't done our work properly.
Exactly.
So this would make sure that our work is taken care. Okay.
Right.
And always call back after 3 months.
Okay.
Okay.
Right.
If you have done when you're call back after 2 weeks once to see
Okay.
how it is. So it would give you an indication about one is you can evaluate your own work.
Right.
Second, it will also tell you whether the patient is abusing his teeth or taking care of his teeth.
Exactly. Right.
So if you feel that okay, his maintenance is not up to the mark, you tell the patient right away. You have something that you have to take care. Like you
Exactly.
have a BMW car, you have to maintain it. You can't use it like
Exactly.
how you use a Maruti 800 or Alto.
Yeah.
So you tell him what I've given you is a BMW car, so you have to maintain that way.
Right.
Okay. Then you do another round of polishing after 3 months.
Okay. Right.
Do polishing 3 months. Then call back every 6 months and offer polishing.
Right. 3 months, then 6 months, every 6 months. Okay. Sir, if we do a composite when we are in third year of BDS, we prepare a good cavity because it's not an amalgam. So we prepare definitely a cavity and then we start using the composites. If it's a very deep, we can fill it with a flowable and then build the composite on it further. But if not, when we are in third year, we do not know all these things. So how to build that cusp, how to learn that, providing that fissures, providing that pit and fissures thing, and how to build that, how we can learn or how we can better that in a way, whichever level we are now.
Yeah, for that you have to go back to your second year, you go back to the implantation installation.
Yes.
Because see, the sad part is when you're actually learning that in second year, nobody tells you that you are doing it because you have to do a filling in future.
Right.
Has anyone told you that in second periods when you're doing those wax blocks? We
No,
thought
sir.
we have to do a good wax block and give it to the professor, and then he has to approve. So we
Right.
had no idea that we are doing it because you have to carve a good cusp when you are doing a composite, because you have no idea
Exactly.
what a composite in second year.
Exactly. Yeah.
So there is a problem how we learn a few things in BDS. So that is not in our control. But what is in our control is patient's mouth and the teeth. So
Yeah.
if you are setting out with a good placement, imagine.
Right.
Okay. There is a good cusp. It's just a big cavity. with a probably deeper and proper class one. Before you remove the decay, you take a putty impression of that single tooth.
Exactly. Yeah.
This is called occlusal stamp technique.
Yeah. Occlusal stamp technique.
So you take that impression, keep it aside, you build it. The final layer when you build, put it back and cure it. It forms a nice cusp, and you have very minimal occlusal adjustments when you are actually going to do it.
Right. Exactly.
Okay. You could do it as a two-step also. You could have, if the cusp is badly broken, you take an impression, build the cusp outside the mouth on a cast with wax, then take the impression while doing composites, you do it.
Right.
But if you have a large cuspal restoration, as a clinician, I would advise don't do composite, go for porcelain only.
Okay, right.
Because see, people opinion can vary. I may differ with some doctors who say composite
of course.
It's still possible. But with my experience, I can tell that I would prefer a porcelain restoration, an onlay, not a crown, an onlay to a large composite.
Right. Sir, for the onlay, what do we have to actually do?
See, in terms of preparation of the tooth for onlay, it is quite like how you do a veneer. You should make sure that there are round edges everywhere. And try and avoid converging walls.
Right.
There should be a free, in and out movement of the restoration.
Right.
And if there is a cusp, involved, you make that part of onlay. Don't leave half the cusp because it becomes a stress point on the occlusion.
Right.
And clear round margins, no sharp edges anywhere.
Right.
And if you have a deeper cavity under onlay, you still can use flow composite, block it. So that becomes a level, a base. Then you take the impression for an onlay. Then you build a cusp outside the mouth with the porcelain.
Right. So impression is by the putty only?
Yes, you have to use, you can use a single step with a bite tray also.
Okay, right.
Putty and, light body together. In a single step you can do it if you have, if you can manipulate it very well.
Okay,
if you are not very sure, go with two step. Take a putty first, then cut out the putty and put the light body back and take
light body. Right. Sir, so from your so much experience, like of 21 years at least since graduation, what would you suggest, like mistakes to avoid for the aspiring dentists who are new to this field in terms of handling the clinic or in terms of your clinical experience? Any mistakes you would suggest us to avoid?
One is, I would say, don't sell yourself cheap. That's the first mistake that doctors do, because see, what we do is not selling products. So, like we are not e-commerce or we are not shop sellers where you can compare and say, okay, I'm cheaper, so you come to me. I have seen that the people try to start at that point saying that I'm keeping the cost lower than the other guy or on this road, or in my town I'm the cheapest, and come to me. Because the moment you do that, you are opening yourself to people who are coming only for the cost, not because you want to do a good work.
Exactly.
So, because no professional in the world says, no lawyer says that way, I'm the cheapest, come to me, or no auditor says that. So why should a dentist be different?
Exactly. And when ours is a craft thing more.
Yes, and it is such a hard. There is so much of hard work involved with your mind, body, and so much physical strain on ourselves, and you have to think so much, do everything, and also talk so much. So it is not an easy job. If it's for patients may not understand, they don't care also.
Exactly.
Many of them are looking just at the cost, but then they are not going to stay for long if you want to deliver good quality work. Because once you are stuck on the cost, you can't really move up in quality, because how long you will keep the costs low, because the materials don't come cheap, the experience don't come cheap.
Exactly.
So how long will you do that? And we are not running like you take money from somewhere and then put it here, and then you offer cheap goods to the patient. So it's not going to work like that.
Right.
So that is the first mistake that they have to avoid. Build your practice based on the quality.
Exactly.
And be transparent and very clear cut with the patients. So I have understood that being transparent, and straightforward helps rather than trying to beat around the
Yeah,
bush on.
manipulate them or yeah.
Yes, and also I see that there is one school of thought where you try to scare patients. I don't really believe in that. Give information and let them decide what they want to do it.
Exactly.
Yeah, so that way, at least they appreciate. See, I would like to think that 90% of the patients want honest doctor.
Right. True.
Okay, so you cater to that 90% of the people. Don't try to cater to the 10% of the people. They will never be happy with
Yeah.
anyone.
Right.
So that's what my advice would be. So be honest, transparent, and keep your price. Don't try to get into a price war. Keep the quality good.
Yes.
Then they will come to you.
True, sir. Sir, is smile over always necessary? Because sometimes, people want white teeth. They don't understand the teeth are always in the shades of yellow and white. Yes,
Yeah.
they already have white teeth, but they still want white teeth. So I would suggest them that you don't need it until and unless you are, maybe getting married or something important. So, sir, is smile makeover always necessary?
No, it is not always necessary. Sometimes when the patient comes to me asking for smile makeover, there are instances where I said, you don't require it, go back home.
Exactly.
Be happy with what you have.
Yeah.
Because a few things cannot be changed. We can only
Right.
do what is possible. So if you try to take up every patient that comes for smile makeover, whether the patient really requires or doesn't require, then it's not going to be good for you.
Exactly. And so can it be done for any age?
Yes, that is possible as long as periodontally they are sound.
Yes.
Okay, so the periodontal health is very important, and if you don't have the obvious issues that aging gives you, like severe loss of vertical dimension and attrition.
Yeah.
So if those things are not there, then it's all right. So I have worked on almost like a 74-year-old patient for a smile makeover.
Okay.
So I don't see any problem if everything is good in the health perspective.
Right. And so it can start by, I guess, 17 or 18 years, because once your permanent teeth or every bone is made, and then we can proceed with that.
Yeah. Because 18 plus, less than 18, I wouldn't advise, because you should be able to see that the face has matured for you to fit in those teeth. So that is the minimum cutoff age.
And so now the patient's favorite question, Doc, how long it is going to stay? What would you reply to that?
See, there are two things. One, what data says. Second, what your experience says.
Exactly.
Okay. So for someone with minimum experience, you have to give data.
Right.
Okay. So the data gives that 90% of the restorations, especially porcelain, I'm talking about, not composites, veneers or porcelain crowns, they last for almost up to 20 years.
Oh, okay.
Yeah. And 95% last for 5 years.
Okay, right.
93% last for 10 years. This is data. This is not my numbers. These are data.
Yeah, right.
So that means all over the world, out of 100 restorations, 95 are lasting for 5 years, 93 are lasting for 10 years, and 90 restorations are lasting for 20 years.
Yeah.
So that's a comforting data. It's a good data.
Yeah.
But the catch is that everything has to be ticked. The good clinical work, good lab work. So that's like ideal conditions of, if you're calculating mileage, you calculate ideal conditions.
Right.
So that's what. Okay. But still, it's a good data. Then the second number you can give is based on your own experience. Now, if the first veneer I did has crossed 20 years now. This February, in 2001, I did my 4 veneers on a patient. It has crossed 20 years now. They're still there in patient's mouth.
Okay.
So I can say that my own restorations have crossed 20 years. I'm yet to see if there is a need for them to be replaced now.
Right.
So whatever data I have given you is almost coming close to what I have been doing for 20 years.
Right.
So I also believe that the data is true now. Because it's almost the same numbers that I am seeing with my own work.
Right.
Okay. So my suggestion is, don't fix a number to the patient like that. And also going with this warranty is not a very good idea, because you really, this is something that they're using in their mouth. Okay,
Yeah.
it's not like a product that they buy and keep it outside and
Keep it
leave it.
exactly.
Okay, so the many things that contribute to the longevity of those things. So don't give any guarantee or warranty, because no sane doctor in this world gives a guarantee or warranty for any medical
Right.
procedure. So we should not be different. But you can
Yes.
always tell that there is assurance with the data and with my experience.
Yes.
So that is the truth. You are not making up things. You are telling the truth.
Right.
So if anybody has a doubt, they can just go back to internet. All you need to do is look at Google.
Yeah.
Google gives you these numbers in any case.
Right.
So that is the best way to, because again, better to tell the truth. Don't tell that, okay, this is the I'm giving you a guarantee for 50 years, 20 years, 30 years. No, this is the data. This is how they will work. So if you want that, fine, you go ahead and get it done.
Exactly. And so how about the composite filling? Simple lower molar filling. If a patient say ये कितने साल टिकने वाला है, या like we should definitely then again give the range and explain the same things, because material, our expertise, and how the patient maintains it, everything plays a
Yes.
role.
Yes. See, good composites last for 10 years also. I've seen,
Right.
if you talk about just a class 1, I have patients whose composites I've done in 2001 and 2 are still there in many of the patients' mouth. Some wear out, okay, again, depending on the aging of the patient and many parafunctional habits and all of that. But what the number that you can easily give is like about 5 years.
Right.
Definitely 5 years you can give for a good composite. So that at least, see, again, even if you buy something very expensive in real world, would anyone give you more than 5 years?
No, I don't think so.
What is the warranty for your laptop?
Sure, sir, it's
What is,
less than that.
yeah, and what is the warranty for an iPhone? People spend like
Oh,
80,000, 1 lakh for an iPhone, probably 1.5 lakhs also now. What is the warranty that they expect?
maximum 1 or 2 years.
Yeah. So this is truth. They have to use. They are using it. They are eating on it every day, every night. So
Exactly.
yeah, you can tell an average lifespan. So you can tell, like, out of 10 fillings that I have done, 8 have lasted for 5 years plus. So which is a good thing. So if you want to spend the
Right.
1,000, 2,000, or 3,000, whatever you charge, you spend 80,000, you expect it to last for 1.5 years warranty. But you want to spend
Right.
1,000 rupees and want it for 100 years, it's not going to work.
Exactly. And so what about if we put now the curing light comes with 5, 10, 15, 20 seconds. So if we are doing a composite and if we cure it for like maybe 5 or 10 seconds and not 15 to 20 seconds, will that matter?
Yes, that does. There is for every product that you use, there is something called as manufacturer's
Yes.
instruction. So you have to follow, because they have done their product according to research. It's not a product that has just
Right.
come out of thin air.
Exactly.
So when they tell you that this is 2 mm, you have to use 40 seconds, or this is 2
Exactly.
mm, you have to use 20 seconds, or this is a bulk fill, you can add 4 mm, but you're only for 20 seconds. Follow that.
Exactly.
Any
Right.
deviation, see, your experience does not make a replacement for the manufacturer instruction.
Right.
And it's just because you have done 10 fillings with a 15-second curing and then they have lasted, doesn't mean you are right. You're wrong.
Exactly. Yeah.
If the manufacturer says that 2 mm 40 seconds is the norm, you have to do only that. And
Exactly.
likewise, if putty says once you mix, 3 minutes is the minimum working time, or 4 minutes is the
Right.
setting time in the patient's mouth, you can't remove it in 2 minutes and expect the impression to be good.
Exactly. Exactly.
So it has to be, you have to follow the instructions, because there is a reason for that.
Right, and we are never taught to read the instructions, sir. In the second year, when we are mixing the gypsum and dental stone. So yeah.
Yeah, there is a difference. In second year, you are a student, so now you are a practitioner
Yeah.
who is responsible for the patient. So anything
Exactly.
that comes, open the box, sit through the entire instructions, read everything.
Right.
Because
Right.
even the same material, it can there are different instructions from manufacturer to manufacturer. You buy GC, there is like
True.
2 minutes. If you buy
Yeah.
Dentsply, they may say 3 minutes. So whenever you're changing the material, go through the stuff again, the instructions.
Exactly. Sir, if so, what is like how what makes you the best in your field? What's your secret success?
I don't think I'm the best, though it makes me happy to hear that. One is, I would say, yes, success. Yes, I would agree. One, I don't know anything else.
Right.
I only know one thing in my life, and I only do that.
Exactly.
I'm very bad at multitasking, and I really admire people who actually multitask.
Yeah.
Even somebody like you know, who can do interviews, who can do dentistry, and probably take care of the family, everything you're doing, and I really admire that. I'm really bad at that. I can only do one thing at a time. That is, my job is only dentistry, and
Yeah.
I realize that I'm good at it, so I stick only to that. So I don't teach, I don't conduct courses, I don't go to college
Yeah.
to take classes, nothing else.
Exactly.
So I feel that that is one of the reasons, because consistently I'm doing the same thing. And second, I always feel every case is a very tough case. I don't really think any case is an easy case. When
Yeah.
patients come and tell me my case is very easy, please do it, I think you can just do it. I don't think, from my heart, in my heart, I'm looking at it, oh, this is a tough case. So that way, I'm trying to clear wherever there are loose ends, and not trying to
Right.
get complacent. That okay, this is what I have to look at. I have to look at. See, the moment you think that this is a very easy case, you forget to look at the problems.
Yeah.
So I always consider every case as a very tough case and a new case. Then I stick to the plan. So that way, you are eliminating errors and trying to reduce problems or failures. So I would attribute
Exactly.
my success to that. So
Okay.
being best, I have no idea. I mean, I would stick to, see, I always worked for the benefit of my patient and myself. Not really
Right.
I never expected anything from the fraternity. It's not like, I wanted to be
Yeah.
known as the best in my by
Right.
dentist. No, that was
Right.
not never my goal. If people recognize it, I'm happy about it.
Exactly. And sir, for example, if we are doing a case of smile makeover, we know that we would not be able to do it. So whom, just for example, for impaction, we know we have to call an oral surgeon. For
Yeah.
this smile makeover, whom we should be consulting?
See, you can always refer cases out if there is a good trust between the doctor and the referral person.
Right.
Okay. Again, the patient also has to be understanding about that.
Yeah.
Otherwise, if someone is freelancing, it's always possible if you trust that
Right.
person.
Exactly.
Like I said, it encompasses many fields in our own dentistry.
Right.
So you could be a periodontist and a good cosmetic dentist. You could be a prosthodontist and a good cosmetic dentist. You could be an
Exactly.
orthodontist and still be a good cosmetic dentist. So
Right.
it's see, again, you would probably call a surgeon based on your relationship with the surgeon and your trust in the expertise. So the same
Exactly.
should go with even a smile makeover.
Exactly. So
I'm
it
sure
should
it
be
is
the
not
skills.
just
It
yes,
should be the
yes,
skills we should be looking for, and not the
yeah,
what they are into.
yes. So when
Okay.
you're giving your patient to somebody else, your aim is not the money part of it.
Exactly.
It's a trust part of it.
They're in the right hands.
So yeah, so that's what should go into selecting who can treat your patient.
Exactly. Now, sir, there is Veneers. What we initially thought that Veneers is made up from composite, like different things goes into the lab which brings out the Veneers. Now, what is the difference between composite Veneers and porcelain Veneers? Of course, porcelain is also a material, but what is the difference?
See, composite veneer is what you do most on the patients. So composite is a material which is used intraoperatively. So
Okay.
it's a direct veneer. So whatever you are doing
Right.
in the patient's mouth, like you said, I know I'm done in 30 minutes for a restoration. Everything I
Yeah.
have. Okay.
Yeah.
It's a material of what you do with your own hands.
Okay.
Okay. So, but whenever you're using a material inside the patient's mouth, you have limitations. One
Right.
is basically, the strength is the biggest limitation when it comes to composite.
Exactly.
And like you already said, staining and discoloration
Yeah.
and the longevity in turn. Okay.
Right.
That's where porcelain comes into picture. Porcelain is not something that you can use in the patient's mouth. You have to
Exactly.
do it outside the patient's mouth. So it's an
Right.
indirect veneer. So if you are looking at long term, the patient wants like 5 years, 10 years, 15 years, then you are looking at a porcelain. If you are looking
Right.
at short term, you could go with composites. But longevity, more expensive, but then long term is definitely porcelain. Porcelain
Yeah.
is lab made, so you go back to the lab after taking the impressions, then you start making it there in the lab. And ideally, a dentist also should be involved in the entire lab process of making a porcelain veneer.
Exactly.
See, when you're
Exactly.
doing composite, you are doing it yourself, right?
Right. Right.
So when you do a porcelain, why would you want to just leave everything to the technician?
Exactly.
So you also have to be involved in. It's not like you send it to the lab and comes back and then you fix it. No, you have to
Right.
be there to make sure that this is what you want for the patient.
Exactly. Sir, so whatever veneer is coming from the lab, it is porcelain. And
Yes,
whatever we are doing, of course, that would be a composite veneer.
composite. Yes, because composite you're
Okay.
taking out the material yourself and doing it on the
Yeah,
patients too.
exactly. Okay. So I guess you have explained everything very clearly. Thank you so much. But sir, my last question before we prepare for a veneer, like
Yeah.
the porcelain veneer, before we start preparing for veneers, what exactly the burrs you would recommend, or what's your, like, how you do it?
See, first thing when you do a plan, a smile makeover or a veneer, you good clinical examination, which includes extraoral, intraoral, and look at the skin tone, eye
Hmm.
color, everything. You have to. It's a thorough examination. Then
Exactly.
take a set of impressions, diagnostic models. Okay.
Right.
Then do a mock-up first.
Right.
So don't set
Exactly.
out to do the treatment directly on the patient's teeth. Do a mock-up
Hmm.
first, then you know what you are planning to change. If the patient has gaps, you have done the mock-up, so you know this is the width of the teeth going to be, and this is how the teeth are going to look like. Then involve the
Exactly.
patient in the decision making. Then you
Right.
set out to work on the patient if the patient agrees. Okay.
Right.
So the first burr that you have to use is a depth marking burrs, because
Yes.
if your veneer is going to be like 0.8 mm, 1 mm, then you have to cut only so much, right? So you are
Yes.
marking the depth. That is the first burr that you have to use. Then go
Exactly.
ahead with your chamfer and shoulder, rest of the burrs to finish the preparation. Then you can use a fine grit like red or yellow burrs to finish the whole
Yeah.
preparation. Then take impressions. The first burr you always use is a
Right.
depth marking burr.
Depth number, exactly. So because we are definitely taught this, but while also preparing crowns, when we are doing the patients, we definitely forget this. We never use pencil, or we never use, the mark. But for
Yes,
veneer especially, I really believe that this is really important.
yes, it is very important.
Okay. So thank you so much for your time. This was the session I was really awaited for. Thank you so much.
Thank you very much. Thank you very much. So,
Have a good
uh,
day.
thank you very much. Bye.
Thank you, sir. Bye bye.